Hello, my name is Cecilia Miller. Today I'll be presenting the case of Jordan, a 19-year-old who is beginning adulthood after aging out of foster care. Jordan's situation demonstrates how this transition can become more challenging when a young person is expected to become independent without consistent family support. Throughout the presentation, I'll consider both the challenges Jordan is facing and the strengths he brings as he works towards creating a stable future. To better understand Jordan's needs, I'll look at his case from several different perspectives. I'll first apply Erkinson's psychosocial theory and Levinson's theory of life structure and discuss the strengths and limitations of using each framework. I'll then explore how experiences during adolescence and personal, family, cultural, spiritual, and social factors can influence young adulthood. I'll finish by connecting Christian and social work values to practical evidence-based recommendations for Jordan. Jordan is a 19-year-old and has recently aged out of foster care after experiencing 8 different placements since age 6. He is now expected to manage responsibilities such as housing, employment, finances, and education with limited support. TISO 2026 research shows how the transition out of foster care can involve multiple areas where continued support is needed. It is equally important to recognize Jordan's strengths. He graduated from high school, currently has transitional housing, and has experienced a desire to attend community college. The first framework is Erkinson's psychosocial theory. According to Hutchinson and Charlesworth, the primary developmental conflict of young adulthood is intimacy versus isolation. Intimacy is not limited to romantic relationships. It also involves developing trust, emotional closeness, commitment, and meaningful connections with others. This is particularly relevant to Jordan because repeated placement disruptions may have affected his opportunities to experience consistent relationships. His current mistrust suggests that developing supportive connections should be an important part of intervention. The second framework is Levinson's theory of life structure. Hutchinson and Charlesworth described ages 17 through 22 as the transition into young adulthood. During this period, individuals begin developing a structure for adult life through decisions involving relationships, education, employment, values, and independence. At age 19, Jordan is directly within the transition. His interest in community college, need for stable employment, financial responsibility, and desire for independence all demonstrate how this framework can be applied to his current circumstances. A major benefit of Erkinson's theory is that it helps us understand the importance of relationships and belonging during this stage. However, one limitation is that development does not follow the same timeline for everyone. Jordan should not be viewed as unsuccessful simply because he currently struggles with relationships. Mytelka and colleagues examined social support networks among youth exiting foster care, which reinforces the importance of considering the support available to young adults. With Jordan, I would focus on trust building and developing reliable social connections. Levinson's theory is beneficial because it addresses practical areas that are highly relevant to Jordan, including education, employment, relationships, and independence. One limitation is that the original research did not represent the full diversity of young adults, and developmental milestones should not be treated as universal deadlines. Jordan may need additional support because of his foster care experiences. Rather than expecting immediate independence, his social worker can help him develop manageable goals for college, employment, financial management, as well as stable housing. Personal and family experiences during adolescence can continue influencing young adulthood. Ben Shlomo and colleagues found that young adults who experienced foster care break down reported concerns involving anxiety, self-worth, trust, and attachment. This research is relevant to Jordan because of his repeated placement disruptions and current struggles with mistrust and anxiety. However, we should not assume that his past determines his future. Jordan's graduation and interest in college demonstrate motivation, and these strengths can be used to support his continued development. Jordan's transition should also be understood within his cultural, spiritual, and social environment. Cultural beliefs may influence how a person understands independence, education, work, and relationships. Spirituality may provide meaning, coping, or community if it is important to Jordan. As social workers, we should explore these areas rather than make assumptions. Social support is particularly important because youth leaving foster care may rely on different formal and informal networks. Jordan's housing, transportation, education, and employment opportunities are also part of his developmental environment. Adolescent experiences can influence how a person approaches adulthood, particularly when there has been significant instability. Ben Shlomo and colleagues found that foster care breakdown could have continuing emotional and relational effects, including difficulties with trust and attachment. Importantly, their findings also identified adaptive coping and resilience among some participants. This is important when considering Jordan. His history should be acknowledged, but intervention should also recognize his ability to develop new coping strategies, supportive relationships, and a more stable future. A strengths-based approach is particularly appropriate for Jordan because his assessment should not focus entirely on deficits. Meyer's research on strength-based intervention for foster youth emphasizes empowerment and self-efficiency. Jordan already demonstrates several strengths. He completed high school, has educational goals, and is participating in transitional services. The social worker can build on these abilities by including Jordan in decision-making, recognizing his progress, and helping him develop confidence in his ability to successfully manage increasing adult responsibilities. Christian teachings also provide values that align with social work principles. Colossians 3:12 emphasizes compassion and kindness, while Micah 6:8 emphasizes justice and mercy. Genesis 1:27 supports the inherent worth of each individual. In Jordan's case, these principles can be demonstrated through empathy, advocacy, dignity, and respect for self-determination. Importantly, incorporating a Christian worldview into professional practice does not mean imposing religious beliefs on Jordan. Instead, these values can guide how the social worker approaches and advocates for him. Overall, Jordan would benefit from an intervention plan that addresses both his immediate needs and his long-term development. TISO highlights the broader transition from foster care. Mytelka and colleagues demonstrate the importance of social support, and Meyer provides evidence supporting strength-based intervention. Jordan may need assistance with anxiety, housing, employment, budgeting, college enrollment, as well as relationship building. These services should be collaborative rather than prescribed for him. The overall goal is to help Jordan develop stability, meaningful connections, confidence, as well as sustainable independence. In conclusion, Erickson and Levinson provide complementary ways of understanding Jordan's transition into young adulthood. Erickson emphasizes relationships and connection, while Levinson helps explain the development of an independent adult life structure. When these frameworks are combined with current foster care research, strengths-based practice, and attention to Jordan's environment, the social worker can develop an individualized plan that addresses his challenges while also recognizing his strengths, goals, and capacity for continued growth.